All right, so let's dive into acute sinusitis.
Sounds good.
I think we've all been there, right?
Yeah.
Sinus infections, misery.
Absolutely.
We're going to be focusing on Chapter 7 from the WHO's Aware Book, Access, Watch, Reserve.
Mm-hmm.
And this is really going to be especially useful for our medical microbiology colleagues out there.
Great.
We're going to unpack kind of the essential facts.
Okay.
The clinical considerations. We're going to get into, the nuances of diagnosis and management.
Perfect.
Really get into the weeds a little bit.
It's a great choice because it's such a common condition, but I think there's still a lot of confusion surrounding it.
Yeah.
Misconceptions even. And as microbiologists, we're really key in making sure that we're doing the right testing.
Right.
And that we're using the right treatment strategies.
Absolutely. So let's define it. What is acute sinusitis?
So acute sinusitis is an inflammation of the paranasal sinuses and the nasal cavity. It's usually triggered by a viral upper respiratory tract infection,
Okay.
like the common cold.
Right. So we get a cold, it develops into this.
Right. It's the duration of symptoms that makes the distinct.
Got it.
So with a cold, you might be better in a week. Acute sinusitis can linger for up to 4 weeks.
So it's that persistent congestion and facial pressure.
Yeah.
That really sets it apart, huh?
Yeah.
And I'm guessing the clinical presentation can vary depending on which sinuses are affected.
You're absolutely right. The clinical presentation can really help us narrow down where the inflammation is. So, for example, if they have pain over their cheekbones, that might suggest maxillary sinusitis, pain in the forehead, frontal sinus involvement, and then, of course, we have our classic symptoms, right?
Yeah.
Nasal drainage, congestion, facial pain or pressure, and sometimes even a cough.
Now, I know there's this myth, this persistent myth, that yellow or green mucus equals a bacterial infection. But I know that the Aware Book sets the record straight on that.
Absolutely. Color of the mucus is not a reliable indicator of bacterial infection.
Got it.
I think it's tempting to make that association.
Sure.
But the WHO really emphasizes that we need to look at the whole clinical picture.
Okay. So let's talk about lab tests then. As microbiologists, we love our tests, right?
Right.
But in this case, are they always necessary for a diagnosis?
So this might surprise some people, but routine lab testing is not generally recommended for the initial diagnosis.
So we're relying on the clinical presentation.
Exactly. Remember that the majority of acute sinusitis cases are viral.
Yeah.
And they resolve on their own.
Yeah.
So the symptoms, especially when you take into account the patient's history and the duration of their illness, they give us enough information.
Got it.
To make a confident diagnosis.
So it's a case of watchful waiting.
Exactly.
Rather than rushing to order tests.
Exactly.
Okay, I like it.
Now, of course, there are exceptions.
Of course. There always are.
So if they have severe symptoms,
right.
Or if we think that there might be complications developing, or if we think that the diagnosis might actually be something else, then further investigations might be needed.
So let's talk about those exceptions then.
Sure.
What kind of scenarios would make us consider additional testing?
So one scenario would be a patient who has a persistent high fever.
Okay.
And we're talking 39 degrees Celsius or higher.
Got it.
Along with the other classic symptoms.
Yeah.
If that's been going on for 3 or 4 days with no improvement, that's a strong signal that maybe we should think about antibiotics.
Okay.
Another scenario would be patients who have chronic conditions.
Okay.
Like diabetes or a weakened immune system.
Right.
So those patients are more likely to get complications from acute sinusitis.
Okay.
So in those cases, we might start antibiotics sooner rather than later.
So it's about weighing the risks and benefits.
Exactly. It's a balancing act.
Yeah.
And then, of course, there are some red flags that tell us that something is seriously wrong.
Yeah.
We need to act immediately.
Right.
And this often means antibiotics. So, for example, if we see signs of systemic toxicity, like altered mental status,
Got it.
or if they develop a severe headache that doesn't go away, those are concerning signs. We can't ignore them.
Makes sense.
We have to be on the lookout for those signs of something more serious.
Right. So let's say we've decided antibiotics are the way to go.
Okay.
What are the recommended choices? Are there any dosage recommendations in the WHO guidelines?
So the Aware Book gives us clear guidance here.
Okay.
The first-line antibiotic for acute bacterial sinusitis is usually amoxicillin.
Okay. Amoxicillin, a classic.
Yeah.
Why is it particularly well suited for acute sinusitis?
So amoxicillin typically works well against Streptococcus pneumonia, which, as we discussed, is usually the culprit in these cases.
Yeah.
It also has a good safety profile.
Right.
Generally, it's well tolerated.
And what about the dosage? Does Aware give specific recommendations?
Yes, it does. For adults, the typical dose is 1 gram every 8 hours.
Okay. And for how long?
5 days. For most uncomplicated cases.
So a pretty short course. What if amoxicillin isn't an option?
Yeah.
Allergies?
Yep.
Resistance concerns?
In those cases, amoxicillin clavulanic acid is a good alternative.
Okay.
So the clavulanic acid helps to fight beta-lactamase-producing bacteria.
Right.
So it gives us broader coverage.
So that's really helpful, especially with the whole antibiotic resistance issue, right?
Right.
What's the dosage for amoxicillin clavulanic acid?
For adults, it's 500 milligrams every 8 hours.
Okay.
Again, that's for 5 days.
Okay. So we have, good guidelines for first-line and alternative options, dosages. Are there any other factors that we should keep in mind?
I think a couple of important points.
Okay.
First, we always have to be aware of the local susceptibility patterns. Antibiotic resistance, it varies by region.
Right.
So we have to stay up to date on what's happening in our area.
Okay.
It helps us pick the best antibiotic for each patient.
Right. Make sure we're not prescribing something that's going to be ineffective.
Exactly.
What's the other key consideration?
We also have to think about each individual patient.
Of course.
So some patients might be allergic to certain antibiotics.
Right.
Or maybe they have other health conditions that affect our choices.
Okay.
It's all about tailoring the approach to the patient's individual needs.
That's a good point. It's a good reminder that clinical judgment and personalized care are so important.
Absolutely.
So we've covered the presentation, diagnostics, treatment. Now let's talk about kind of the underlying mechanisms.
Okay.
How does a cold, turn into this whole inflammatory saga in the sinuses?
Yeah, that's a great question. So to understand the pathophysiology, we need to think about the anatomy.
Okay, anatomy. Let's have a quick refresher. How are those sinuses connected to the nasal passages?
So the paranasal sinuses are air-filled cavities in the skull bones.
Okay.
They're around the nasal cavity.
Yeah.
They're lined with a mucous membrane that produces mucus, which helps trap dust and other particles.
Right.
Each sinus has a small opening called the ostium.
Ostium.
And it connects it to the nasal cavity.
Got it.
That allows the mucus to drain.
So there's a flow of mucus from the sinuses into the nasal passage.
Right.
What happens when a cold virus comes in?
Okay. So when we get a cold, the virus infects the lining of the nasal passages. That causes inflammation and swelling.
Okay.
And that inflammation, it can spread to the ostia.
Okay.
Those small openings that connect the sinuses to the nasal cavity.
So they get, narrowed.
Exactly.
Blocked because of the swelling.
Exactly. And when they're blocked, the mucus can't drain properly.
Yeah.
It starts to build up.
Oh, that sounds like a problem.
It creates this kind of stagnant environment.
Yucky.
Yeah.
What happens then?
Well, that trapped mucus, it becomes a breeding ground for bacteria.
Oh, no.
They love that warm, moist environment.
Yeah, of course.
And as they grow, it just makes the inflammation and the pressure worse.
Right.
So it's this cycle.
Yeah.
Inflammation, blockage, bacterial growth.
So a harmless cold turns into a full-blown sinus infection.
Exactly.
Makes sense.
So it really highlights the importance of keeping those passages clear.
Right. Now, let's talk about the epidemiology.
Okay.
Where does acute sinusitis fit into the kind of, the bigger picture of respiratory infections?
Yeah, so it's a common condition, but I think it's important to put its prevalence into perspective.
Okay.
So according to the Aware book, acute sinusitis only accounts for about 0.5% of all upper respiratory infections.
Really?
Yeah.
That's actually really low. It seems like everyone's always dealing with a sinus infection, especially, during cold and flu season.
Right. It feels really common. I think that's because the symptoms can be so bad.
Yeah.
And they tend to linger.
Right.
So it's a memorable experience.
But most of the time, it's just a virus, and it doesn't lead to sinusitis.
Exactly. So it's a small part, but it's a part that can cause a lot of problems.
It makes you wonder if, if that perception of prevalence might lead to overprescribing antibiotics.
You've hit on a really important point. The Aware book actually talks about that problem of antibiotic overuse in acute sinusitis, especially in high-income settings.
Why do you think that is?
Well, I think it's probably a few things.
Okay.
There's often pressure from patients who want relief quickly.
Yeah.
And then I think there's also a misconception that antibiotics will speed up the healing.
Even in viral cases.
Even in viral cases, yeah.
So as microbiologists, we really need to be advocates.
Right?
For judicious antibiotic use.
Mm-hmm.
And we need to educate both patients and other healthcare providers on the importance of following the guidelines.
Absolutely.
Okay. Let's talk about the microbial world of acute sinusitis.
Okay.
We know that most cases are viral, but let's talk about those usual suspects.
Okay.
What are the most common viruses that cause acute sinusitis?
So the Aware book actually has a list.
Oh, perfect.
It ranks them by frequency.
Great.
At the top is influenza virus.
Okay.
Both type A and B.
Influenza.
Makes sense. Yeah, it's known to cause a lot of different respiratory symptoms.
Yeah.
So it's not surprising that it's a big player here, too.
What else is high on the list?
Next is respiratory syncytial virus, or RSV.
Okay.
This one's a big concern in kids because it can cause more severe respiratory illness.
RSV, yeah. It's a regular in the pediatric wards, especially in winter.
Yeah.
And, of course, we can't forget rhinovirus.
Of course not.
The king of the common cold.
Always causing trouble.
Always up to no good.
Yep.
And now, in recent years, coronaviruses, including SARS-CoV-2, are on the list.
Yes.
So even COVID can trigger acute sinusitis.
It can.
Yeah.
So we've seen that COVID-19 can sometimes lead to sinusitis.
It's a good point. It's a reminder that we're still learning about these viruses, right?
Certainly.
What other viruses are there?
So we've also got parainfluenza virus.
Okay.
And then just a category for other respiratory viruses.
So it's a pretty diverse group.
Yeah, it is.
Now, I know we've said bacteria are less frequently involved, but we still need to be familiar with the potential bacteria, right?
Right.
Especially as microbiologists.
Absolutely. So viruses are the main drivers.
Yep.
But bacteria can take advantage of the situation when the sinuses are already compromised.
Okay, so which ones do we need to look out for?
So the Aware book gives us a list.
Oh, good.
At the top is Streptococcus pneumonia.
Of course.
Which we've already talked about.
Streptococcus pneumonia, it's everywhere.
It really is.
Pneumonia,
right.
otitis media.
Yeah.
And now sinusitis.
It's a very versatile pathogen.
What other bacteria should we be aware of?
We've also got Haemophilus influenza.
Okay.
Moraxella catarrhalis. And Streptococcus pyogenes. Group A strep.
Okay. All familiar names.
Yeah.
Any other less common ones?
In rare cases, you might see Staphylococcus aureus.
Okay.
So it's important to keep an open mind.
Yeah.
And we need to consider all possibilities.
So even though it's less common, we have to be aware of those bacteria and think about them when we're making decisions.
Exactly.
About diagnosis and treatment.
Yep.
Okay.
Now that we've covered the microbiology, how about we test your knowledge with some exam questions?
Sounds fun.
Yeah.
After this deep dive, I think I'm ready.
All right, great.
Bring on the questions.
Okay, so question number 1. Which of the following is the most common causative agent of acute sinusitis? A, Streptococcus pneumonia. B, rhinovirus C. Haemophilus influenza. D, Moraxella catarrhalis.
You're trying to trick me with the bacteria.
Yeah.
But I remember it's usually viral.
Got it.
So I'm going to go with B, rhinovirus.
That is correct. Rhinovirus is a very common cause of the common cold.
Right. Which can then lead to sinusitis.
The other options can cause it, but they're not as common.
Okay. Glad I didn't fall into that trap. What's next?
All right, question number 2. Which of these symptoms is not typically associated with acute sinusitis?
Okay.
A, facial pain. B, nasal congestion. C, earache. D, purulent nasal discharge.
So facial pain, nasal congestion, purulent discharge, those all sound like classic sinusitis.
Yeah.
Earache, I feel like that's more of an otitis media thing.
You are correct.
So I'm going with C, earache.
That's right. Ear pain can sometimes happen because of referred pain from sinusitis, but it's not a typical symptom.
Okay, good. 2 for 2.
All right, give me another one.
Question 3. In a patient with suspected acute bacterial sinusitis, which of the following would be the most appropriate initial microbiological test?
Okay.
A, blood culture. B, nasal swab for culture and sensitivity. C, sputum culture. D, urine culture.
Okay, so we're thinking about an infection in the sinuses. So we need a sample from there.
Right.
Of those choices, a nasal swab for culture and sensitivity makes the most sense to me.
That's the right answer.
So I'm going to go with B.
A nasal swab will let us see which bacteria are there and how sensitive they are to different antibiotics.
Okay. So targeted testing.
Exactly.
A guide treatment.
What's next?
Question 4. Which of the following is not a typical indication for antibiotic treatment in acute sinusitis? A. Symptoms persisting for more than 10 days without improvement. B. High fever and purulent nasal discharge for 3 days. C. Mild symptoms for 5 days with gradual improvement. D. Signs of systemic toxicity, such as altered mental status.
Antimicrobial stewardship.
Yes.
Don't always need antibiotics,
Right.
especially when the symptoms are mild
Right.
and getting better.
Yeah.
So I'm going to say C, mild symptoms for 5 days with gradual improvement. That just sounds like watchful waiting to me.
You are absolutely right. That's a situation where you wouldn't jump to antibiotics.
Okay, good.
The other options, though, they are situations where you would consider antibiotics.
Got it.
Okay.
Bring on that last question.
All right, last question. Which one of these statements accurately describes the pathophysiology of acute sinusitis? A. It is primarily an allergic reaction to environmental irritants. B. It is caused by direct invasion of bacteria into the sinus cavities. C. It is an autoimmune disorder that affects the sinuses. D. It involves inflammation and blockage of sinus ostia, often initiated by a viral infection.
Okay. I remember our discussion about the blockage of the sinus openings. That seems crucial.
It is.
So I'm going to go with D. It involves inflammation and blockage of sinus ostia, often initiated by a viral infection.
You got it. Excellent job.
Ooh, 5 for 5.
You've got a great understanding of acute sinusitis now.
I feel a lot more confident, that's for sure.
Good. That's the goal.
Thanks to this deep dive.
It's about understanding the details of this condition.
Yeah.
Which can be tricky sometimes. And remember, the Aware book is a fantastic resource.
Oh, yeah.
Full of evidence-based guidance on how to manage acute sinusitis and how to use antibiotics responsibly.
Absolutely. We'll put a link in the show notes.
Perfect.
For anyone who wants to, dig a little deeper.
Good idea.
Before we go, I have a question for our listeners to think about.
Okay.
We talked a lot about how to manage acute sinusitis.
Right.
But what about preventing it in the first place?
That's a great question.
What can we do to reduce the number of cases, especially those caused by viruses?
Well, things like vaccination against those common respiratory viruses, that could be a big help.
Okay.
And we always need more research.
Of course.
Into other preventative measures, like nasal saline rinses. Or just better hygiene practices.
It's a reminder that there's always more to learn.
Always.
In the world of microbiology.
Absolutely.
So until next time, keep those sinuses clear.
Yes.
Keep those minds curious. And those antibiotics reserved for when they're truly needed.
And for our fellow microbiologists.
Yes.
Keep up the amazing work in the lab, helping with treatment decisions and advocating for responsible antibiotic use.
Absolutely.